Hi, today I'll be demonstrating an ultrasound guided injection of the ankle. The patient is a 60-year-old lady with ankle pain. The pain is brought about by walking and relieved by rest. She has no evidence of current involvement of other joints. She underwent SVF treatment to both knees 6 months ago, and this has provided her sustained pain relief. She has tried conservative treatments for 6 months for the ankle without any relief. Hence, she is motivated to seek a biological treatment to her ankle joint in view of the relief provided to her knee joints by SVF injections 6 months ago. After excluding other causes of hind foot and ankle pain, the diagnosis based on clinical examination and x-rays is primary osteoarthritis of the ankle. Ankle osteoarthritis is rarer than knee osteoarthritis. There is an incidence of about 7% in the general population. Causes include previous injury to the ankle like an ankle sprain, recurrent sprains, foot malalignment like flat foot, altered biomechanics secondary to varus knees. In this lady, as I will show you in the video, she has varus knees or bow legs due to knee osteoarthritis. You can see the legs of the patient. You can clearly see the varus deformities pronounced in both the knees. And now we are going to show her walking. She will walk with the varus gait. Now you can see the varus alignment. This can cause the subtalar joint to go into valgus and place increased load and stress on the outer part of the tibio-talar joint. When you see the number of toes from behind the back, so this is the connection between the subtalar joint and the knees, the biomechanical abnormality. This is the case as I show you on the ankle x-rays. There is a suggestion of a slight joint space narrowing in the outer compartment. MRI has not been done. I will be injecting platelet-rich plasma into the ankle under ultrasound guidance under local anesthesia. PRP injections may relieve symptoms, although the current evidence is not strong. However, patients do demand relief. An ankle fusion should be the last resort for pain relief, but this procedure is not as successful as knee replacement. The ankle will be stiff after this procedure. So a PRP injection is worthwhile trying after full disclosure of the facts to the patient. Positioning. She is lying on her back with her knee bent to 90 degrees and the foot is resting flat on the table. I will be using the linear transducer or flat probe. I am using aseptic precautions with sterile cover over the probe, sterile jelly and sterile technique. You can now see the procedure. Now I am performing an ultrasound guided evaluation of the ankle joint. And you can see straight away there is a pulsation over there. That's the pulsation of the artery. And you can see the bone there. This is the upper margin of the talus, flat margin of the upper margin of the talus. So you've got, I've set the ultrasound with a single focal plane just below the talus bone. Okay, so and we'll adjust the depth. Now we have got the adjustment of the depth. We're going to visualize the lateral side of the ankle. You can see the pulsation there. Now I'll put on the Doppler over there, color Doppler. That's the color Doppler. I'm shifting the color Doppler to the area of pulsation, and I want to reduce the area of the color Doppler. So this is the frame rate, 32 Hertz per second. The depth is 2.6 centimeter, and we are able to see the pulsation inject. So I'll be injecting the ankle joint by long axis approach. And this is the ankle joint, this is the talus. I will be injecting it from the medial side. And if you approach it from the medial side, you can see that the vessels are quite far away. The vessels are here, and our needle will be coming into the ankle joint from here. I'm going to prepare the part. I'm going to keep it here. Under aseptic precautions, we have a betadine here, sterile gauze, local anesthetic. I've already applied a lidocaine cream to the patient's ankle. So that way the skin will be already numb. You're going to draw up lignocaine 1% in the syringe, in this syringe, and will be infiltrating the skin alone. You've got a sterile offsite. This is a dressing which will go over the probe. This is a sterile jelly which will go on top of this dressing to form an impermeable liquid barrier between the ultrasound and the patient's skin. Here there are syringes and needles. We'll be injecting PRP into this joint. We already prepared the PRP. There is 6 ml of PRP in this syringe with betadine. Next I will be infiltrating lignocaine into the joint. I'm going to aspirate in the syringe to see if there is any retroflow of blood into the syringe. You can see that there is no blood. I'm infiltrating on the skin medial to the tibialis anterior tendon. Tibialis anterior tendon is there. Jelly. Wait. Well, a sterile glove. Just I'm going to now change into sterile glove. Okay. And I will be applying an offsite alternate. So this is offsite. Take the offsite and put it over the probe so that the end of the probe is now sterile. And now I'm going to put sterile jelly over this. Using the linear probe, 14 megahertz frequency, the aspect is this side. So this will go on the right side of the patient. I'm using the MSK ultrasound. I'm putting sterile jelly over it now. So this is the ankle joint. And I'm going to introduce the needle into the recess over here. The joint is swelling up. See, the joint is distending. See, you can see the joint distending. Yeah? Clear cut. Needle is there, no? Finished. Hope this video was informative. If you think that this procedure might help someone you know, share it with them, like it. If you want to see more videos, subscribe to my channel and press the bell icon to receive a message when I upload new videos. See you in further videos.